Good morning, good afternoon, and good evening. Welcome to today's webinar. We're going to be getting started shortly, right at the hour. So if you can please wait 5 minutes or so as we allow more of our attendees to enter into the space today. Thank you for logging in early. Good morning, good afternoon, and good evening. Welcome to today's webinar. We'll be getting started in about 3 minutes. So thank you for logging in early, and we look forward to hearing from you. Please feel free to introduce yourself in the chat. We'd love to hear where you're joining us from. Good morning, good afternoon, and good evening. Welcome to today's webinar, where we'll hear about lessons learned from the first round of states graduating from TCI. We'll be getting started promptly within a minute or two. We welcome you to introduce yourselves via the chat so we get to learn more about you and where you're joining from today. Once again, welcome all to today's webinar. My name is Lisa Mwaikambo, and I'll be assisting my colleague Lakan in moderating the Q&A. But for now, I'd like to turn over the mic so that he can officially welcome you and we can get started today. Lakan, over to you.
All right, thank you very much, Lisa. Good morning, good afternoon, and good evening, everyone, from wherever you're joining from. Welcome to the webinar for today. The title of this webinar is Lessons from Government-Led Family Planning Programming in Nigeria. And we'll be hearing from TCI graduating states. And my name is Lekon Ajijola, and I work with Johns Hopkins Center for Communication Programs on the challenge in Nigeria. And like Lika said, I'll be moderating this session for today. Okay, so first, I want you to know how excited I am to be here today and to be part of this webinar. Considering the fact that we've come so far to get to this point, I'm sure that we are all excited as well and looking forward to hearing from the states. Again, our topic is lessons from government-led family planning programming in Nigeria. The states we'll be hearing from today are Bauchi, Niger, and Delta states. So I'll just take a while to quickly remind you about the Challenge Initiative. The Challenge Initiative, popularly called TCI. And it represents a business unusual model which helps state governments to drive implementation of family planning program in an efficient and sustainable manner. The goal of this is to achieve state government self-reliance in helping states to scale up family planning and adolescent and youth sexual and reproductive health best practices in order for them to be able to sustain improvements in their urban health systems, as well as increase the use of contraceptives, especially amongst the urban poor. The initiative is funded by Bill and Melinda Gates Foundation, Comic Relief, Bayer, and other private philanthropists. The program is currently implemented in 5 regional hubs across the world, and that includes Nigeria, India, East Africa, Francophone West Africa, and the Philippines. In Nigeria, TCI is implemented by Johns Hopkins Center for Communication Programs. The program in Nigeria commenced in September 2016 and is currently in its 5th year of implementation. The TCI program is also currently implemented across 14 states and 137 local government areas in the country. We had 5 initial states that came on board the program, and that includes Niger, Bauchi, Ogun, and Kano states. They joined the partnership as part of the first rounds of states to partner with TCI in Nigeria. Plateau, Rivers, Abia, Taraba, and Edo states joined in the second round, while we had Nasarawa, Lagos, and Gombe states recently joining the program in the 3rd round of partnership with states. TCI has supported the states represented here today to achieve greater self-reliance in family planning programming. And again, the states that we're showcasing here are Bauchi, Delta, and Niger states. And as these states have gone through all the stages of the TCI program, including the startup stage, the surge or scale-up stage, the pre-graduation stage, and they are now at the point of graduation from the TCI program. So it will be good for us to hear panelists who are key family planning stakeholders and champions from these graduating states. Our first panel is Dr. Mohammed Rewan. Dr. Mohammed is the Executive Chairman, Bauchi State Primary Healthcare Development Agency. He is passionate about family planning and actively promotes family planning in his personal and official capacities. He has facilitated the implementation of several family planning programs, and that includes the adoption of TCI Impact family planning best practices in the states. He also ensures that funds are appropriated to family planning in the states each year. Welcome to the webinar, Dr. Mohammed.
Thank you. Thank you very much.
You're welcome.
Thank you very much. Thank you.
Our second panelist is Dr. Philomena Okeowo. Dr. Okeowo is a public health practitioner whose professional work spans decades. Apart from children, reproductive health, and public health in general, stems from a burning desire to ensure access to affordable health services for the poor and vulnerable. Currently, she is the Director of Public Health, Healthcare Development Agency. Dr. Who led the team that wrote the expression of interest to partner with TCI in 2017, and she continues to work assiduously to see the manifestation of the results of that partnership. Welcome to the webinar, Dr. Okeowo.
Thank you, Lekon. I'm happy to be here.
You're welcome. panelist is Barrister Rachel Obodo Bonsali. Barrister Rachel is a trained humanitarian law and human rights specialist, a gender specialist, health rights advocate, and policy analyst. She leads civil society platforms in Delta states on sustainable development, open budget, and tax justice, and also engages in budget analysis, tracking, and monitoring of project implementation. She's currently the chairperson of the Advocacy Core Group in Delta State. Welcome, Barrister Rachel.
Thank you very much. Nice to be here.
You're welcome. Our fourth panelist is Dorcas Talatu Abu. Madam Dorcas is a trained nurse with over 15 years of experience providing reproductive health and other integrated medical services. She has a capacity of over 1,000 workers to provide quality family planning services in the state. She currently serves as the State Family Planning Coordinator with Niger State Development Agency, and she supports implementation of donor-funded projects, including that of TCI, Maria Stopes, Health Access Initiative, Association for Reproductive and Family Health, and Pathfinder projects. We welcome webinar, Madam Dorcas.
Thank you, Leko. Nice to be here.
You're welcome. The next panelist is Ajia Jara Yahya. Ajia Jara serves as Bauchi State Family Planning Coordinator. She provides direction and oversight for family planning programs in Bauchi State. She has worked extensively with and also built the capacity of healthcare planning. Ajara works seamlessly with implementing partners, media organizations, civil society organizations, and communities in creating demand as well as improving access to quality family planning services to women of productive age. Welcome you to the webinar, Ajia Jara.
Hello, everyone. Good afternoon. I'm happy to be here.
You're welcome. Our last panelist for today is Mr. Abraham Bako. Mr. Abraham is a researcher and information specialist, providing support to reproductive health, maternal health, neonatal and child health, immunization, HIV/AIDS, family planning, nutrition, malaria, and gender programs in Niger State. He has over 9 years of experience in program support, information management, data analysis and use, and has also supported implementation of donor-funded projects, such as that of AFENET and the Bill and Melinda Gates Foundation-funded Niger State Health MOU. He's currently the State Monitoring and Evaluation Officer for the state's Primary Healthcare Development Agency, and he has also in the past supported UNICEF as a technical facilitator on RMNCA H+N scorecard. You're welcome to the webinar, Mr. Abraham.
Nice being here. Nice being here. Over.
Okay, so a warm welcome again to all of our panelists, and we look forward to hearing and learning from you during this webinar. So we'll just move on from here and allow the panelists to share their experiences with us. For the participants, kindly note your questions in the Q&A box as we go through the webinar. We may also be able to take a few questions live at the end of the session. Please remember to indicate which of the panelists you are directing your questions to. Thank you. So Dr. Mohammed will go first. Dr. Mohammed, we would like you to briefly describe government leadership for family planning program in Bauchi State in the past few years. Please tell us what it was like before and what has changed. Over.
Thank you very much. Are you hearing me? Thank you very much. I must say that before we have low capacity in terms of family planning, less teamwork, poor coordination of family planning services and logistics support, poor data gathering and implementation. But with the coming of TCI, in the first part of the year, they've improved our capacity for all our human resource who are working on family planning. And then in the first year also, the TCI also make sure that we learn what called the 72-hour makeover. We are not used to it. We learn 72-hour makeover. And host site orientation was also being implemented in Bauchi State. And quality improvement team, we are not aware of it. Later, we learn about what is quality improvement team. And then social mobilization, the in-reaches and outreaches services were actually implemented and improved in Bauchi State by the other part of the TCI in Bauchi State. And strong advocacy movement towards family funding and accountability was also done during the same period. And then the state took most of intervention to scale up to LGA, because we have what we call PSC working group and other working group. We scale up all the intervention to all our local government services. And then we speak to the state official plan and implement fund mostly family planning activity together with our other partners in the state promptly, and we have annual operation plan where TCI is also part of it, and the annual operation plan for all our partners and the state government. And then we're working, making sure that, and the PSCMOU, under the PSCMOU. And then what has changed now? You can see the data now. This is data for Bauchi State. You can see on the data, you see we have 7 million people in Bauchi State. And then there's the total population of Bauchi State. And then we also have about annual growth rate of 4.2%. And then total fatality rate per NDHIS 2018 is 5.3. And then contraceptive prevalence rate is 6.5%. Unmet need for family planning is 20.8%. You can see this is our data on family planning in Bauchi State. Now, what has changed is the consistent funding released from family planning budget line. We have a family planning budget line in Bauchi State, which was increased. It was 17 million when we came. It went up to 140 million annually, and that was released. And then TCI contributed to about 53% increase in adjusted annual family planning client volume, which comparing the baseline of about 12 months before TCI implementation with the latest period ending in March 2021. You can also see that this amount to 22.688 family planning clients in TCI demonstrated LGA, representing more than half of the family planning client recorded in Bauchi State for the same time period. This increase is even more impressive in 98% of the increase constituted lack accepted. That means long-acting family planning was being accepted by our people. And during the COVID-19 vaccination, there was an out of stock, a lot of cry. I received a lot of call from clients, from fathers. That is what's important. Male, female involvement increase, and the male are the one carrying their parents, wives to the facility to collect family planning, and they prepare long acting. It was so available. It was a war. I did not sleep. Receive call from almost every LGA that where are this family planning intervention? Though there was a lockdown, we could not get supply from our partners and the government of Nigeria, and it's supposed to be free, and it was not there. So that was a big challenge to Bauchi State. If I will be around in this world and I have the opportunity to congratulate at least the Bill and Melinda Gates for giving us this opportunity, I will ask that we need more of the TCI. We had another organization before, the NURI, but it was not, the teamwork was not there. The issue of data gathering and implementation was poor. And then the other implementation, particularly 72-hour makeover in Bauchi State today, we have started the 72 hours makeover. They did about 25 72-hour makeover in Bauchi State. We did about 6. This year we are doing about 3. I already wrote memo to the government of Bauchi State to give us approval for. We have already taken. That means we have taken over the activity of TCI in form of the sustainability. Are you hearing me now?
Yes, we can hear you. We can hear you.
I thought that there's a limited time. We'll have talk and talk more.
Thank you very much, Dr.
Because there's there are many things to say. But they told me that the time limited. I have other people to talk.
No, you may still have more talk maybe before the end of the session. Thank you very much for sharing those valuable insights with us. Indeed, that's changed in the state and there has been notable improvements. Thank you very much.
Thank you very much.
We'll go to Dr. Okelwo. Dr. Okelwo, please share with us which family planning high interventions work best in your state and why? Which ones will the state continue to implement post TCI support? Over.
Okay. Thank you, Lekon. There were many high impact interventions that TCI introduced in Delta State. Let me start with the coordination meetings. TCI supported the state to strengthen coordination of partners working in the reproductive health space. We held weekly, and we still do, we hold weekly update meetings religiously where implementation challenges are resolved. And this has made the state to drive and own family planning implementation and help effective collaborations and leveraging of resources too. In Delta State, the coordination meetings are actually driven by the state. Secondly, we've had health facility based in enriches, and this centers on taking family planning service provision to desiring clients who may not have the opportunity to provide quality family planning services free, as clients do not have to pay from their pockets. And this has really worked for us. TCI also helped us to strengthen our data quality. It's much improved now. Though Delta State family planning reporting rate is still not where it should be, but we have greatly improved. TCI supported us with coaching and mentoring of both the LGA and state HMIS officers on quality data reporting as well. Then for family planning social mobilization, TCI supported the state to train community mobilizers on family planning. These mobilizers conduct neighborhood campaigns and they leverage on key life events to sensitize women of reproductive age and adolescents on benefits of family planning. And they refer interested persons to nearby health facilities to assess methods. This also helped us they supported 72 hours makeover in 3 facilities in Delta State. These facilities, the Busa General Hospital, Okpanam PAC, and the La Primary Health Center. These facilities did from both the mental makeover that came with it, the family planning clinic, waiting area, instruction and counseling rooms were worked on, and basic family planning medical equipments were also supplied. To sustain all these, the state is poised to continue the coordination meetings so that we can continue to resolve implementation challenges quickly. Then, the family planning social mobilization. Our PACs right now, we have health educators, and they will continue these neighborhood campaigns. Also, the state has also been selected to implement the community health influencers and promoters program, which is the chief program. And for this program, we had a political word and planning social mobilization, this particular process. So our data quality, we continue to be sustained, because apart from the local government HMIS officers that were trained and mentored by TCI, the state personnel were also trained and mentored. And they will continue, the state personnel will continue the mentorship, leveraging on the integration of all programs, all programs supporting supervision that is already ongoing. The state has also been funding enriches. It will continue to do so. Even the LGA reproductive health supervisors on their own, they've been using their initiative to coordinate enriches in low reporting health facilities in their LGAs. They will be encouraged to continue to do so. The attention of the state will also be drawn to the need to particularly renovate family planning units in our healthcare facilities, because the state periodically renovate health facilities. Thank you, over.
All right. Thank you very much. We're able to hear all of the interventions that you described, despite some disruptions in the internet. Really, these are impactful interventions that delivered results. Kudos to you and the team. Kindly mute your mic, please. Speaking at this time. Kindly mute you. Okay, so if you're just joining us, you're welcome to this webinar on government-led family planning in Nigeria. The webinar is hosted by the Challenge Initiative, and we're currently listening to experiences from key stakeholders in TCI graduating states of Niger, Bauchi, and Delta states. Now to Barrister Rachel. We'd like you to tell us how planning funding landscape changed in Delta states, and what role did the ACG or the advocacy core group play? We also want you to share with us if the state government will be able to fund high impact interventions going forward without partners' support. Over. Barrister Rachel, are you there? I see that you're still, okay. Mike muted now.
Can you hear me, sir?
Yes, now I can hear you. We can hear you now. Did you get the question?
Okay, thank you. Yes, I did. Thank you very much. Yeah, I'm glad to be here. Advocacy core group in Delta State were inaugurated on the 26th of January 2018 with the major roles to advocate for a budget line for family planning in Delta State, to increase the number of policy or key decision makers speaking in favor of family planning, and of course to enact laws and policies that are family planning friendly in the state. And with time, these roles have also evolved, because initially we did not have a budget line for family planning in the state. But currently we have a budget line separate from the generic or the general Ministry of Health budget line. Initially, the sum of 8 million was earmarked for family planning, but in the last budget it was increased to 20 million. And so we're happy about that. And currently the budget is being implemented. So it means that we've had release of funds. So now the work or the role of the ACG has evolved. We are no longer speaking about a budget line, but we are preaching and advocating, campaigning that there will be increase, because 20 million naira would not go around the state, judging from the population that we have in Delta State. And so we are advocating that there will be increase in the budget line, and also a timely release of these funds is what we are asking for. And then, of course, TCI has supported the ACG from the very beginning, where we had the smart advocacy training. It equipped and built the capacity of members to be able to carry out good and effective advocacy. And after that, of course, we did the budget analysis and tracking, which we are supposed to be implementing now, because implementation for the new budget line has just begun. And so with the master training in budget analysis, the ACG will be able to track the progress of the implementation, both for releases and expenditures. And of course, we're also trained on advocacy briefs, where we can develop advocacy briefs and media briefs. We've also trained the media and then the interfaith forum in Delta State. And now, what the role we have played here is that we have worked hand in hand with the Ministry of Health, the Primary Healthcare Agency, and all the relevant stakeholders, including the executive and members of the House Assembly, especially the House Committee on Health, where we had to canvass for the initial budget line. And then, of course, for them to also continue to speak, we recorded voices to speak in favor of family planning. We had various advocacies. We've had over 15 advocacies to relevant stakeholders, and also decorated notable people in the communities as champions. These champions range from traditional leaders to religious leaders who would help us dispel myths and misconceptions about family planning in the state. And currently we have subdivisions of the ACG, which is the Interfaith Forum and the Media Advocacy Group. This group would help us drive home further the activities of the advocacy core group, because they have very specific and peculiar audiences, and so they will drive home the point. And so we plan to continue to maintain strong relationships with decision makers in these areas that I've mentioned. And of course, we've had incidences of where clients were charged or patients were charged money at primary healthcare centers for them to access family planning, but that is no longer the case. Everybody is talking about family planning. The state government, as a matter of fact, the state governor talks about it at every given opportunity, because development in the state is also tied to family planning services. The First Lady of Delta State, as shown on the slide, is one of our champions. She talks about family planning in every occasion where she has the opportunity to talk to women. So these are some of the things or some of the ways we were able to help. What are sustainability plans? Some of the sustainability plans, one of the things we plan to do is to register the advocacy call group as a legal entity, because we discovered that one of our challenges in going to some places for advocacy is that they tend to ask questions about our legal status with the Corporate Affairs Commission. So by the time we have a registered document and a physical office, our advocacies will be legalized and will be more recognized by other entities. And of course, we'll be able to attract funding from other organizations, not just for family planning services or issues, but also other health programs in the state. And of course, we have an online presence at the moment. We have just recently opened a Facebook fan page where we will post activities of the advocacy call group. I would kindly, if permitted, share the link on the chat box so we can also access it from time to time. And then on whether the government of Delta State will be able to sustain the funding for family planning in the state. I think the handwriting is written clearly on the wall, because if from no budget line like 3 years ago to a budget line, and then they allocated an amount, then increase it a year after, and currently we are implementing that budget line. It means the government of Delta State is ready to continue to carry out family planning and in fact make progress. So I believe we will be able to sustain this also with more advocacy, more campaigns, and more sensitization. Thank you very much.
All right, thank you very much, Barrister Rachel. I mean, it's pleasant to hear how the government has demonstrated to demonstrate financial commitment to FP through the efforts of the advocacy call group. Thank you, and well done. Okay, so next question is for Madam Dorcas. Please tell us, what lessons have you learned working with the Challenge Initiative? Would you say has been the most important? Over.
Thank you, Lekon, and thank you for this privilege. Good afternoon, all. I'm going to talk about the most valuable experience and lessons learned from working with TCI in my state, which is very huge, but for this purpose, I'm going to limit it to some few points. Working with TCI has been a great privilege to us, and it came right on point when we needed them to intervene in our state, especially when the indices were going down and the uptake of family planning in the state was very low. One of the interventions and lessons we have learned working with TCI is the 72 hours makeover that was implemented in some of our facilities in the state. You all know that public facilities in some states lack privacy and confidentiality. So when the TCI came, they were able to implement the 72 hours makeover, which they renovated the facilities and created room for privacy, especially, you know, how family planning uptake it is in some of our localities here. The clients don't always want to come to where everybody is going to see them. They need privacy. So immediately that was implemented in our facilities, we recorded a huge turnout of clients to these facilities, especially the turnout of the adolescents, which we know they are one of our target groups in delivering reproductive health to them. So this, a lot the states have taken into cognizance, and they are working seriously on it to replicate this same activity in some of our facilities, which presently they have already done in some facilities. And it is going to continue as one of our sustainability plans. Then the integration of family planning into maternal and child health week was one of the activities that boosted the uptake of family planning in my state. Before the coming of TCI during the Child Health Week, we were not into it seriously. But when they came, they saw it as a quick win for us to increase our indices and to create awareness among the people, especially in the hard to reach areas, which once we did that, there was a huge turnout and success. We didn't stop there. The state continued during every maternal and child health week. We implement our family planning activities and we record huge turnout of clients to these facilities. Then another one is the on-the-job training of health facility providers. Before the coming of TCI, the conventional training was the kind of training that was going on in the state, where you have to move most of the providers away from their primary assignment, I mean the facilities, to a particular particular place in the state or a particular local government where all of them will be trained together. But now we move to them, we identify the gaps first by doing the assessment. After that, we go to the facilities to train these people on the job, the health providers. And by doing that, it has also expanded access and create access in building the capacity of a number of healthcare providers, which we never thought would be able to train in the state. Then the enriches. We have what we call neighborhood campaign in my state that is being implemented by TCI. So the community volunteers that create demand in the community goes out during facility enriches days being organized by TCI, supported by the state, and they mobilize clients to this facility. This has created ownership, made the people to know that yes, the facility belongs to them and they need to go to these facilities to uptake these services. Unlike before, they don't see the need to go to facilities. They want everything to come down to them. But with the demand generation activity, people are well informed now, people are enlightened, and they see the need to go to the health facility. Another one is the annual operational plan. I want to tell you that TCI in the state did not work alone. They work closely with the state. The state takes the driver's seat while they support us from behind technically. And I tell you, this has brought a huge support because during the annual operational plan, we sit down together on a round table together with TCI and other partners in the state to prioritize the activities of the family planning and see which one we are going to go for first, and we work together. This also, we have achieved a lot of results in that aspect. Finally, I want to tell you that I'm happy to inform you that presently for sustainability plans, we are already implementing most of the activities that TCI have supported us in. Just as I have mentioned earlier, the 72 hours makeover, the enriches on the job training, and so on. We are glad that it is yielding huge results. But I am sad that we are one of the graduating states. Please, if there is anything you can do to continue to implement your work in Niger State to support us, we are going to appreciate that because we have every enabling environment for work to go on and to achieve results. Over to you, Leko. Thank you.
All right, thank you very much. Thank you so much for sharing. This is much appreciated. The lessons that you have shared are really much important. I've also collected. Kindly mute your mic if you're not speaking at the moment, please. Madam Dorcas, just to say that you are graduating, you're now going to be a teacher. You help us facilitate implementation in new states. A good thing, but we'll take it on. Thank you again very much. So again, if you're just joining us, you're welcome to this webinar. It's on family planning programming in Nigeria by the Challenge Initiative, and we're listening to experiences from our champions in Bauchi and Delta states. Please remember to leave your questions in the question and answer chat just beneath your screen. Okay, so we'll just move on quickly to Ajay Jara. Ajay Jara, we're interested in knowing if there are government systems and structures to support the gains family planning program in Bauchi State. How functional and sustainable are these structures? Over. Ajara, are you there? Did you hear me?
Can you hear me?
Yes, we can hear you now.
Good afternoon, everyone. To that, I would say yes, we do have government system and structure in place to support the gains recorded on FP program in Bauchi State with the TA from TCI. One, we have a recurrent budget line that now exists in the state, which funds major capital FP interventions, such as training, 72-hour makeover, and even massive awareness campaign. This is as a result of the good efforts or the work of the ACG, who are on and about ensuring that our budget line for FP interventions are there and they are released as of when needed, and they are used judiciously for the purpose those funds are made for. And also we have an all routine interventions that are captured in our state annual operational plan, which help us to coordinate partners' commitments and also for the state to fund through the basket funds and other management funding sources in the state. So with this annual operational plan that we have in the state, which annually we sit down to come out with all activities for all programs, not only the child spacing program, that is the family planning program, for all activities. It gives a room for partners to come in and bring in their work. This is the intervention. This is where we are going to work. And it helps us keep our work in steady. We know what we want to do and what we intend to achieve by whatever intervention we have on those annual operational plan and how to go about achieving results. We make sure that there are high impact interventions that are going to give us results in terms of demand creation, service delivery, advocacy data, and what have you. And also we have a PSU working group and other groups, which under it help us to coordinate and track implementation status. That is, it acts as an accountability mechanism, which starts right from the state level down to the LGA and down to the facility level. This working group meets every fortnightly to discuss what are to be done and what has been done and what needs to be done. It addresses challenges and gaps and help us to show how we are going to overcome whatever challenges and gaps we have in terms of activities. Is it demand creation? Is it service delivery? Is it mobilization? These are the work of this working group. We sit down to track activities from the state level down to the LGA, down to the facility level, to see how things are going and how do we improve, because we are concerned it's not just giving the services. How qualitative is those services? Are the people, are the members of the community satisfied with the services that are being rendered? How competent are our service providers in terms of giving services? How are the community aware of the services that are being given at those facilities? And in terms of tracking those activities, we have the integrated monitoring and supportive supervision, which is carried out quarterly. We go down to the facility to see how services are being rendered. What do we need to support the facility with or with the LGA in order to improve those services? When we had the 72-hour makeovers, we recorded a great increase in the number of women coming to access services as a result of the 72-hour makeover, because it made the facility to be more conducive, more friendly, and also the clients are able to access the method they want. If they don't have those methods at the facility, the service provider knows where to refer those clients where they will get the services they require. And also, this also gives us a chance to see where the gaps are in terms of service providers' knowledge and skills. This brings us to the issue of on-the-job training, whereby you train, you update the knowledge and skill of the service provider in terms of quality of services, and also using of data to improve the services and to improve decision to see how are we faring, what do we need to do to bring in more success, and how do we plan for the coming year or for the next quarter in terms of allocating funds for services in childbirth spacing. Over. And you find out that all this intervention, they need no funds. Is it in terms of meetings of the QIT at the facility level or the whole site orientation, or during the enrich services, whereby the mobilizer go out to tell the community that there are going to be an enrich services in the facility, and these are the services, the women come in to assess those services. And all these are driven by the health workers, by the state team. The state team, starting from the state level, that is the staff of the Primary Healthcare Development Agency, down to the LGA level, down to the facility. They are all our staff, and it's our routine duty to carry out this activity. So we need little or no fund to carry out this activity. And also it's the norm of the agency to drive implementation, coordination, and accountability through this platform, which is the working group, the state working group, that is the PSC working group. We have the service delivery, we have the training working group, we have the financial working group, we have the MIE working group. All this group mobilization coming together to work and bring out gaps and challenges and come up with solution how to move the program forward. Not only the FP, but all the PSC services. We have integrated services. The one May PNC under one roof, whereby we do our team collective. It's an intervention. We just don't focus only on FP. When we carry out makeover, we do makeover in the family planning clinic. We also move to the antenatal and the maternity session, and also the immunization center. That is where we get to meet women and tell them the services that are available and the reason why they should adopt modern childbirth spacing in order to improve their lives and those of their children. Thank you. Over.
All right. Thank you very much, Ajara, for that extensive sharing with us. Thank you so much. We will now move on to the last question, which is to Mr. Abraham. Mr. Abraham, please tell us, what are some of the state's plans to sustain the family planning gains made so far in Niger State, especially with respect to using data for decision making? And we'd also like you to add on recommendations for TCI to improve its operations in new geographies. Over.
Good afternoon, all. To the gains, how to sustain this, the work so far that that TCI have put in place. We still want to leverage on the existing structure that we have, that they have been supporting. TCI have been supporting control room system. Control room system is a system where we harvest data, we share data, we look at data where we have issue, and they are now corrected. Also, we also want to also leverage on the existing structure that we have, the supportive supervision and the OJT, that is on-the-job capacity training. Here is that we want to continue with the supportive supervision in the areas in the facility, so that the facility can sit up and use their data for action. At the same time, use that supportive supervision period to train people on the job as we visit. And also, we have what we call data quality assurance, which we have embarked in Niger State. We have what we call electronic data quality assurance that we are using. So we also want to leverage on that existing structure to sustain the pace that TCI have laid. And also incentive, as you can see in the picture, it shows one of the LG that were given an incentive certificate to show their good performance in the LGA. And we want to also sustain this so that that also will boost the morale of the staff that are working in the facility so that they can put their data together and also report appropriately. And also institutionalize the run chart across board. Not only the TCI facility want to ensure that this run chart also goes across all this LGA, because that helps us. The health facility will be able to monitor and see where they are and what they need to do to improve their data. And that is very important. And also, we also want to scale up, that is expansion to more LG. I think we are implementing in 9 LG. And if we can expand more LGs, I think that also will have a wider coverage. So as in the new, and those new LG that are coming on board, I think we will recommend this for them. And also increase fund for supportive supervision so that supervision also can be regularized, because in the time past, this is our recommendation, that in the time past, the support for supervision has not been regular. So if we can make it regular, that also will sustain that. I think, and if we can also scale up more LGs in the new states that will be coming on board, that also will help that, because all these are stationed towards funding. And obviously, we've worked closely with TCI, and TCI have been a source of strength to the state. They've not led the system, but just as my FP focal person said, they have been, and we have been on the driver's seat, and they are behind, leading us and giving us direction. Thank you. Over.
Yeah, so thank you very much, Mr. Abraham, for sharing your state plan with us. We've also taken note of those recommendations that you have shared with us. Thank you very much. Okay, so many thanks again to all of our presenters. They've done a great job sharing their experiences with us. I'll now hand over to Lisa, who will coordinate the question and answer session. Over to you, Lisa.
Thank you so much, Laikon, and our esteemed panelists. I want to first congratulate everyone. There's some really great comments about really about each state's experience. So just to give a shout out, it was noted in the comments from Moji that, thanks Bauchi for sharing the integrated system strengthening approach used to ensure the FP is fully integrated with PHC and under one roof concept adopted as a roadmap to revitalizing primary healthcare as really the backbone of the health systems. We heard, great work in Delta. There was a lot of interest in learning more about the advocacy core group and how well it's working with the other state bodies. And we also heard from the comments and our attendees about how Niger has been done an exceptional job in really adapting and adopting the on-the-job training modality, especially considering the challenging terrain and human resources in Niger. So great job to all the panelists in sharing your lessons learned. And thank you for also noting already some of the challenges that you continue to face. And as in line with that, one of the first questions that I had caught is related to, it's for each of the states really, and it's related to sustainability. And if a transition of political leadership occurs in your state, what are the signs that you would point to that would explain why family planning programming would continue to be strongly implemented? Do I have any volunteers to kind of kick off a response? So if there's a political transition in your state, what do you think will ensure that family planning programming will continue strongly? Yes, Dorcas?
All right, good afternoon once again. I am sure that family planning activities or activities implemented by TCI with support from the state is going to continue, because when TCI came, they did not just work alone. They worked together with the state, providing support to the state closely. And when you see the TCI team and the state team, you don't even know that they are partners. You think that they are all working in the state. That is one thing, and I admire very well. And I want to appreciate the BMGF and the TCI in Abuja for giving us such great team in Niger State to work with. So with that, I believe sustainability is not going to be a problem, because they have taught us how to drive and drive very well. And as you have heard, we've told you that we are already implementing that in Niger State, with especially the 72 hours makeover, which is already replicated in some of the facilities and the enriches and so on. So sustainability, I don't think is going to be a problem anymore, because we all worked together as a team to achieve results. I don't know if I've answered your question.
Yes, thank you very much, Dorcas. Does a colleague in Bauchi or Delta want to also address that? Are there any concerns about if a political transition happens, whether or not gains can be maintained?
Can you repeat that question again, please?
Sure. So if there's a political transition in the state, do you have any concerns about whether or not the gains in family planning programming will be able to be sustained?
Yes, I would say yes, we can sustain it, because TCI has taught us on how to achieve results with little funds. And you find out that what we were told that most of these activities can be done with no money, with little or no money, in terms of improving services. Is it in terms of ensuring that the budget line is always there, because we have already gotten the commitment of the state government by having recurrent provision for FP budget line. And also we have the ACG, who are always there to see that our budgets are followed up, to ensure that they are released timely. And from the agency, that is from the primary healthcare department, down to the LGA, down to the facility level, we have structures on ground that will ensure that everything moves on smoothly, with adequate supervision, mentoring, coaching, and that's what we need to ensure that our women get those services. The community has taken up ownership, because with the involvement of traditional and religious leaders speaking out for FP services, telling their followers the importance of benefits of childbirth spacing. I think that is okay for us. It's working. We are seeing it going on. We now have men escorting their women to the facility. We see women coming to the facility to access services of their choice. And our service providers has been trained with this on-the-job training. So I think our structures are firmly rooted, and there is no going back. We are going to carry on with it. There isn't much, there's no issue. We are all moving towards self-sustainability. With or without partners, I believe with what we have learned from TCI, we will be able to continue and improve on what we have learned already. Thank you, over.
Thank you so much. And Rachel, I see your hand is up.
Yes, yes, I'd like to respond to that also with respect to Delta State scenario. The issue of budget line or continuous funding for family planning services, whether there's a transition of government or not, is not going to be an issue, because the issue of budget line is it has to do with appropriation, and appropriation of course, work in conjunction with the executive arm and the legislative arm of government. And then, of course, appropriation will flow from previous implementation of previously released funds. So all this taken into cognizance, I don't think there will be any problem for either further appropriation or release of funds. And of course, with the help of the advocacy core group and all other stakeholders, especially the interfaith and the media groups, we will continue to offer technical support to the Ministry of Health, the primary healthcare agencies, and of course the local government, because we are trying to step down whatever we are doing at the state level at the local government level. So by the time all these activities become a practice and becomes law or policy, there will be no problem with transition of government. Thank you.
Thank you so much, Rachel. And I think I have time for one more question. And that is, what do you see the role TCI playing within the broader primary healthcare technical support? So we did hear mention in Niger and I want to say in Bauchi in particular, that it's integrated as part of the annual the AOP, operational plan. But can you speak more to this? And I see hands raised. So yes, Dr. Muhammad and then Rachel.
To say that the Bauchi State government, particularly the wife of the governor, is our champion, and she talks about family planning everywhere she goes, and about gender imbalance. She's always there. I'm the chairman of the sustainability plan we have in Bauchi State. I'm the chairman of the advocacy core group. So the sustainability is already there. Even if I'm not there, the chairman of the primary healthcare is the chairman of the advocacy core group, and I'm also a champion of family planning. And then the technical support by TCI has given us the support that even when the TIAs is not, in fact, they are not even here, we are already working to making sure that there's sustainability. All the activity they are carried out, our staff are supported, and they increase their capacity at both the state and local government level. And then we have an MOU, as Hajara has said. The MOU has ended 2020. But because of the support of the government about the state, making sure that they pay all their counterpart funding, and then they supported, the MOU involves the Bill and Melinda Gates, Dangote Foundation, USAID, and UNICEF, and these are the Bauchi State government. There's an MOU which has ended 2020. But because of the support of the activity we carry out through our annual operation plan and was successfully done, they extended this into another 5 years, 4 years technical financial support, and another 1 year technical support. The 4 years, they are going to give $500,000 by Bill and Melinda Gates, and then another $500,000 by Dangote Foundation, and another organization. We receive support from USAID, another $1 million. And then one organization was so happy with Bauchi State because of our annual operation plan and implementation. They are giving us another $3 million to carry out activity. That is very important. I really have to inform this organization that for sustainability, Bauchi State government is working towards making sure that we continue it. We're going to use it and then to fund family planning activity and operations in Bauchi State. And we are happy to do that because we are champions and want to make sure that there's increased uptake of services. And then most of our stigma and discrimination in Bauchi State by our malams, our religious leaders, both the Christian and the Muslim, has been allayed, because in the advocacy group, all the pastors and the malams are part of the group, and they use the code Bible, the code Quran, to make sure that people accept family planning to reduce maternal mortality and infant mortality. Thank you. Thank you, Oba.
Thank you so much, Dr. Muhammad. And thank you so much to our esteemed panelists for all the great work. And you've really motivated us today with all the progress that you have done, and also how you've shared how some of it isn't really about the money, but then how there's other ways in which to ensure the funding through having dedicated budget line items, but also more more intentional coordination of all partners in alignment with the state's plans. So kudos to everybody. We're going to hear from Lakan to close this out. So if you can just give us another 2 minutes of your time, we'd appreciate it. Over to you, Lakan.
Yeah, thank you very much, Lisa. And once again, thanks to our esteemed panelists for sharing their insights. So we'll be wrapping a sharing of the lessons that we also learned from the graduating states. The first lesson that I would like to highlight is starting with the end in mind. We've been able to see that having state personnel a major part of planning stage of the TCI partnership enabled them to be able to lead implementation seamlessly. That was very helpful. I mean, all the panelists have talked about them being in the driver's seat of implementation and how that has also empowered them to coordinate activities of implementing partners effectively. Effective coordination is what has been key in helping them to also achieve desired outcomes in a more cost-effective manner. We've heard so many times where talked about avoidance and reduction in duplication of resources, duplication of activities, and maximizing synergy and also maximizing impact because of effective coordination. The states have also been able to report that it was extremely beneficial to receive TCI's guidance on how they were able to and select members of the relevant groups in the states, the Advocacy Core Group, the Interfaith Forum, the Social and Behavioral Change and Communication Committee, etc., and a proper selection to commitments and also achievement of results. These structures were also very key in ensuring financial commitment and release, in coordinating demand generation activities and making sure hand in hand with the service delivery component of the program, as well as in creating enabling environment, especially in communities that are traditionally resistant to family planning activities. TCI technical support embedded in the state, and that embedment helped to engender easy collaboration, provision of technical assistance, and increased trust stakeholders working together. Implementing partners also, from our experiences, we've been able to see that learning that it is very important that IPs should set realistic timelines and goals and objectives when planning with the state, bearing in mind this culture, because we know that different states have different peculiarities and they have conflicting priorities. So working with them through the planning phase of the program and through the activity implementation stage is very important to be able to get a desired goal that we all want. And lastly, to ensure that family planning receives maximum attention, we've seen that FP should be integrated into relevant activities at the state's LGA and even at the community levels. And this is what is very important in making family planning a social norm across the states where we've worked, that we've been able to see. So really, these are just some of the lessons that were documented across supported states in the ones that are graduating now, and the Ogun and Kano that are also graduating in 3 months' time, which is for September. Okay, so without taking much time again, I would just want to say that I hope that today's webinar, alongside the insights that have been shared by a panelist, as well as the lessons that I've just shared with us, would enable others in the family planning program space in Nigeria and beyond to be able to strengthen local government leadership capacity in order for them to achieve the desired gains in FP by sustainably scaling up high-impact family planning interventions. These forums for sharing would continue, and they are not just critical to acknowledge and applaud our states and their successes, but also would also help to hold them and us of the family planning community that is accountable to ensure that we continue to planning gains. Thank you all for your time today, as we know that you're all busy. Thank you to our panelists, thank you to our participants, everyone. We also like to use this opportunity to thank our funders, including the Bill and Melinda Gates Foundation, Comic Relief, and Bayer for the support that we keep receiving from them. The women, the children, families are also getting they're getting the benefits of this support that we're getting. Thank you, everyone. We've come to the end of the webinar.
Yes, thank you so much, Lakan and team. The recording will be available on TCIU in a coming day or so. So if you've missed anything, you'll be able to get the recording, and we'll collect the remaining questions and see how we can coordinate responses. So thank you all, and we hope you have a very blessed rest of your day.
Thank you.